Welcome to the Medicare Show. I'm your Medicare advisor and host, Jeffrey Kuhn. And this episode, I'm going to be reviewing the current annual notice of change for Excellus Medicare Blue Choice Select HMO, and that's in the Rochester area network. These plans, each year, and I've said this in the other annual notice of change meetings or informational podcasts, that this is probably the most important document, I'm going to reiterate that here, that people need to look at every year. It comes usually by around mid-September, and it will tell you exactly what your plan changes are going to be for next year. Critical this year. There's so many changes. There's going to be some carriers, including Excellus, that's going to terminate a plan, and this is where you find a lot of information. I'm going to do a quick review on this. If you have this plan, you want to grab your annual notice of change and follow me through this. Or if you're curious about this particular plan, you've got another one. I'll give you some good information. When you open up the document on their annual notice of change, I noticed something on the second page at the very bottom. I'm going to read it to you. I've actually notified Excellus about this because it is proper English, does not, I will say it's just incorrect. So I don't want people to get worried when you see this, but on the bottom of the second page, it says this plan does not include Medicare Part D prescription drug coverage, and you cannot be enrolled in a separate Medicare Part D prescription drug plan and this plan at the same time. This plan does have prescription drug coverage in it. It's called a Medicare Advantage prescription drug plan. It's MAPD. There are MA-only plans, just Medicare Advantage, and some of those are geared towards veterans. You'll see those. But if you do have one of those, you can't get separate drug coverage. But this has drug coverage built into it. Somebody reading this, I think, would get very upset and confused because this plan does have Medicare prescription drug coverage in it, so do not worry. You have it. It's not a problem. So on page 1 of this, it actually starts talking about the summary of important costs. Now, these are some of the quick things that people look at, although people tend not to look at these annual notices of change. The premium. This select plan's been around for a while. It's one of the mainstay older plans that Excellus has had. In 2024, which is this year, there's been no premium. In 2025, there will not be a premium as well. They are raising the maximum out-of-pocket amount, which is going from $7,900 to $8,900. Now, our clients typically don't find this happens because in New York State, we are able to do what we can't do in other states, which I'm licensed in as well, and that's to move plans mid-year or anytime, theoretically, if you get a diagnosis. No pre-existing conditions, no underwriting, no waiting period. So we tend to move plans if something comes up where we're at risk of hitting this out-of-pocket max. Doctor office visits. Currently, outside of your normal physical and any preventative services are typically covered in full. Any other time you'd see your primary care doctor, you're looking at a $10 copay this year. They're actually going to reduce that in 2025 down to $5, which is nice. Your specialist visits are going to stay the same. It's $45 this year. We're looking at $45 next year. Now, inpatient hospital stays. And again, this is something that I'll say is fairly rare. Most folks are an outpatient or they're an observation for a few days. Inpatient means you're actually admitted into the hospital. So this year, should that have happened, you would have paid a $395 copay per diem for days 1 through 5, and then you don't pay after that. Next year, they're going to raise it a little bit. It's not bad. It's going to go up to $425 for the first 5 days as well. Now, again, I rarely have seen people go inpatient. Of all the clients and folks that we've worked with, this is one of the things that happens the most infrequently. The things you got to watch is your outpatient and your ambulatory services and observation stays. That's how most things happen. The prescription drug coverage, the first thing I'm going to say in this one as well is just be aware that Medicare has their standard premium. So any drug coverage cannot be worse than this. That's really what it means. So you're looking at a $590 deductible. You are responsible for 25% of your drug costs, and your maximum out of pocket for 2025 is $2,000. That's Medicare's base level coverage. So anybody can offer better coverage than that. Typically, we do see that in these Medicare Advantage plans with copays. But one nice thing you want to be aware of is I'm going to tell you a way that Medicare is going to structure a new payment plan for next year after I get done reviewing this with this plan. So your Medicare deductible in this plan for your Tier 3 and higher prescriptions is $380, and that applies to Tier 3, 4, and 5 prescriptions only. So you pay that once. Covered insulins and most of your vaccines are not subject to this. So your Tier 1s and 2s are structured a little bit differently. You've got both preferred and standard pharmacies. Now, I know this year the only pharmacy that is not preferred is CVS. They are a standard pharmacy, but everybody else is preferred. So for your Tier 1s, there's no copay, and for next year, there's not going to be a copay for those either. If you go just to a standard pharmacy that's not in the preferred network, it's $5 copay, both this year and next year. Your Tier 2 prescriptions, this is where we start seeing copays. Your preferred pharmacy for that is $15, and it's not going to change for next year either. Your standard pharmacy is $20, both this year and next year. Now, keep in mind, with Excellus, if you get a 90-day supply, they will take your $15 monthly copay, charge you 2 of those, and you basically will get the third month for free. So you'd pay about a $30 copay. And I haven't heard that that's changing at all for 2025. So keep that in mind. Now, your Tier 3s, this is where we're subject to deductibles, and we're looking at a $42 copay in our preferred pharmacies, and non-preferred is about $42 again, which is the same amount. Our standard pharmacy is $47, and that will remain the same. Now, insulin, which is nice in the other plans that they have, they're only charging $30 copays for your preferred pharmacies. There's no deductible on this. If you go to a standard pharmacy, it is a $35 copay, and that will be the same this year as well as next year. Now, where we now are starting to see a little bit of a change in the formularies, a Tier 4 prescription. So if you've had something this year that has cost you $95 to get it filled, as a Tier 4, you're going to pay 50% coinsurance for the negotiated price on that. So that's going to be a little bit of an increase. Your standard pharmacy copay is $100, and it's also going to charge you 50% on your Tier 4. So there's no difference there. So just be aware of that on your Tier 4s. Your Tier 5s, which, rarely do we have people in those, but those are the really expensive prescriptions. It's a 27% coinsurance on your preferred and standard, and next year it's going to be 28% both preferred and standard. So next, there is no donut hole next year on the coverage gap or catastrophic levels, but Medicare does have a payment plan where you can take your estimated annual cost for your prescriptions and you can pay monthly payments even. So it would be 1/12. If you went to your pharmacy, let's use Wegmans as an example, and you're subject to a deductible in the beginning of the year because you have Tier 3 medications. And let's just assume that you're in one of those situations where you've got expensive drugs and you're going to hit your $2,000 out-of-pocket max. They will simply charge you $167 a month every month for your prescriptions. They'll allow you to smooth that out so you don't get hit with a big bill in the beginning of the year. So that's something to keep in mind. One of the things in this annual notice of change, a lot of people will just stop there, but there's a lot of great information. And I'm going to start with page 7. They talk about changes in some of the costs, allergy testing, ambulatory surgery. It's a $390 copayment. It's actually going down to $340, which is really good. Chiropractic copays, if you use a chiropractor, are going from $10 to $15. Emergency room is going from $100 to $110. So there's some really good information. You want to go through and say, okay, here's things that I'm worried about or things I might use, and take a look and see what they're going to cost. Here's something that's a surprise. Eyewear. In 2024, there's a $125 allowance. In 2025, that allowance goes up to $350, which is fantastic. The next item I'm going to spend a minute talking about, because people always get a little caught up in this. And questions I get asked is, still people use the old phrase of silver sneakers. Do I get silver sneakers, which means you get the free gym memberships? Couple changes. Silver sneakers had been changed with Excellus. They've been using silver and fit, which has been great. There's been no cost. You get to go to a number of participating gyms. The nice change next year, they're going to change it to what's called Fit On Health. And again, there is no cost, but the nice thing is you can join more than one gym. There's going to be a lot more locations available with Fit On. So that's actually an improvement, as that's been explained to me. If you have any questions, there's a phone number here, so get a pen ready, and you can call customer service for Fit On Health for next year. Their toll-free number is 855-952-6423. So if you've got questions on this, I would feel free to give them a call. They're available Monday to Friday from 8 a.m. to 9 p.m. So they'll have access to everything. I'm looking here, your inpatient hospital next year. I think we went over that. It's going up just a little bit. And some other things I'm going to take a look at that people tend to use is office surgery. And that's typically a little small procedure for like a biopsy or something if it's done. You're looking at $10 copay on your primary, $45 on the specialist. It's going to go down to $5 on your primary and stay the same at $45 on your specialist. Outpatient hospital services. These are the surgeries that are done, and a lot of them are done in the hospital, and you're kept overnight on observation. So that copay is $390. And people ask all the time, does that include anesthesia? Is there going to be a separate charge? No, that's all included. Next year, it goes down to $340. I'm not sure if I mentioned that already, but that's actually a slight improvement. It's a very, very strong plan for 2025. Excuse me. Over-the-counter items. Every quarter they give you money, or credit, I should say, to spend on things, vitamins, sunscreen, pain relievers, cough and cold medicines, bandages. You get COVID-19 testing kits. There's a whole number of things you can get every quarter. Currently, you've got a credit in this plan of $50. Next year, they're going to go to $90 a quarter. Most people, what they'll do is they'll just call up, they'll order things from them directly and have them mailed. But that's a really good deal. If you take vitamins, I know omeprazole is now considered over the counter. It's no longer covered in most of the plans. So there's things like that that you might get that, this is a great, great resource for you. Second surgical opinions, they actually provide copays for that. This year it's $10 on your primary, $45 on a specialist. Next year it's $5 on your primary, goes down a little bit, still $45 on the specialist. And they do have telemedicine, remote access technology. There's some co-payments for that if you want to get an MD Live. And some great, great things there with that that are available. For the most part, that sums up the annual notice of change. I think the things that I wanted to mention, what you just want to be careful with is your plan changes again for next year. Look at this document and just understand that you've got between October 15th and December 7th. That is the deadline for making your changes for your plan to be effective in 2025. This plan looks fantastic for next year. If you have any questions, by all means, pick up the phone and call me. Number's 585-283-2553. And if you need help evaluating any of your plans with the rest of them that are out there, I can certainly help you do that. Please subscribe to this podcast and certainly share it with anybody that you think this would be beneficial. Thank you for listening. Take care.